let's say, for example, somebody can't make it to a doctor, but they really want to dry up their sores as best they can. Is there any kind of home treatments that you could recommend that you would?
Well, yeah.
Look at this fucking video. Beyond the Imaginary Curve for Brian Austin Landwehr. Look at the fucking imagery in these clouds, man. How the hell people are not seeing this shit as I've been showing people? I don't fucking get you people, man.
High tape,
I don't know.
H-Y, and then tape.
Look at that fucking shit. Look at this one in particular. Look at this one in particular. This particular image right here, right? Fucking plain as day, cannot fucking deny it, undeniable, can't miss it. Now that image is within this larger image, and that image was within another larger image, and then there's millions of fucking little images within all these images, from the veil to the ground.
So the cortisone really just suppresses the inflammatory response and helps the lesions feel better, so they don't hurt as much or sting or itch or whatever, and it helps them heal a little bit quicker too.
That's good advice.
Pardon me?
Oh, that's good advice. What's the name of that product?
It's called High Tape, H-Y, and then hyphen tape, T-A-P-E. And some people can get some benefit from using even cortisone creams, but usually it's a very short-lived benefit. Most of the topicals don't work that great for that long. I think most people have already discovered that. They work very well at first, and then they just stop working, and who knows why that is. So the topicals, for the most part, have not been all that helpful. I mean, people are always writing me and saying, "Oh, I found the answer. I found this great thing that helps." And I'll say, "Well, how long have you been doing it?" And they'll say, "Well, a week." Well, okay, write me back in another week because a lot of times it just doesn't keep up.
So what's the worst thing that you've heard people take that could be a detriment to their health?
I don't know if you want me to say those things because, it's people have done very, very drastic things.
Yeah, they're desperate.
And put very strong, lethal kind of insecticides and gasoline and all sorts of things on their bodies. And some people have had some great success. I don't know why, but there are some people that have put these very toxic things on their body and they have felt better. Of course, I do not encourage this. It's a very worrisome thing to do, to have those things absorbed into the system.
Mm-hmm.
And I did know one patient who had bone marrow suppression because of the toxic things that she had been putting on her skin. So it's a scary thing to do. But as you and I both know, usually people who have this condition are at a point where they'll try anything.
Yep.
It's just such an awful thing, and the sensations are so awful. They're willing to try just anything.
Sure.
Even if it's a dangerous thing, they're willing to try it.
So why don't we all stop lying to them and tell them the truth about what it is?
And why we need to pay more attention to this disease. Because if you've got people out there self-treating by pouring DEET on their bodies or pouring gasoline on their bodies or whatever, I mean, come on. This is some serious stuff. Of course, there are those who would say, well, see, that just is more proof that they're actually crazy and there's nothing wrong with them. So you can always spin it that way,
Yeah, so that leads into my next question. How can a patient really legitimize their condition to their friends and family if they're just dead set against accepting it?
I know, this is what's so hard. And I think one thing that's so important is the language you use. And the nurses and the Charles E. Holman Morgellons Foundation and I are always trying to encourage patients, you have to be very careful about the language that you use.
Lie to them. Lie to them.
It's obviously
Don't even tell them the
there's going
truth.
to be
They're zombies.
sensations that you have that remind you of something, or there's going to be things you visualize coming out of your body that remind you of things. But you can't go into a doctor and say,
don't go into the doctor, period. Don't bother.
A shrimp coming out of my body. You can't say something like that. Maybe you have pink globs and they look just like shrimp coming out of your body. But don't say I have shrimp coming out of my body, or you're going to, somebody's just going to send you straight to a psychiatrist, And so you have to be very careful using descriptive terms, You can say I have exudates, I have things coming out of my skin, and some of them are small and pink and firm, and others are this way, and you have to describe them like that.
Don't go to the doctor.
Really
Fuck the
compare them to
doctors.
something, or not even say things like I have seeds.
They're not helping anybody. Don't even bother.
Don't give them a name.
They'll just refer you to a
Because you don't know that they're
psychotherapist.
seeds. They may look like seeds, and I've seen them. They do look like seeds, but you can't say that. You just say, you have to say, I have the small, firm, white, things coming out of my body that look about like this. Or
You don't have to say anything. Just don't say nothing.
Don't use those
Don't
words,
go.
because that's what immediately turns off the healthcare providers. They hear that stuff and they just immediately stop listening.
And it's really not the doctor's fault, it's the establishment, isn't it?
No, it's the humans,
Well,
it's human people, the human
Think about
population.
how a doctor has usually a very busy day, and they only have 7 minutes to see each patient usually, and if somebody comes in and talking about something very unusual like this, you can understand why they would have a tendency to say, this is something I don't need to pay attention to. But I still think there's a way that it can be presented to family and to doctors, and so that it can be more understood. In other words, it's very difficult to ask patients to do this, because I understand there's a tremendous amount of panic and suffering. But if you could try to stay very calm and just really describe what is happening, like I say, using adjectives, but not using nouns. Don't say, worms are coming out of me. Say long filaments that are I think that you can be taken so much more seriously when you use those kind of descriptive terms rather than using nouns, as I say. It makes it.
Of course, this is always an excellent Christmas gift.
There you go. Yeah.
So how far back can we trace Morgellons in recent history?
Well, I talk about this in my book. I had one patient myself who had it since early 60s. And then his father had it as well. And so I know this isn't, a lot of people will say, oh, this is a brand new thing. It only came about because of chemtrails or whatever, but it's been around longer than that.
Damn right.
It's been around longer. So
thousands of years longer.
It is a new thing. I think that it's probably been in third world countries for a long time, and people just have varying names for it. I mean, this one patient I talk about in the book, he had gone to Mexico back in the 70s, and he had talked to healers in Mexico, and they just said, oh, yes, we know about this, and we call it cactus man disease, and so he, it's just, who knows? I mean, maybe if we go into the deep jungles, into the healers in the jungles, maybe they will. That's what I keep wondering, if there might even be a cure for it by some medicine man somewhere, and deep in the Amazon. Or,
no, right here.
Somebody needs to
right
go
here.
in there and find out.
Right here, everybody got the answers already. They're just denying
it. To it having a palliative effect on the condition.
What about what? I'm sorry.
Cannabis.
Oh, cannabis. Yeah, I think that, that can be a very helpful thing in terms of dealing with a lot of the symptoms for sure. I don't know, if there's any curative effect, but palliative certainly, I mean, it can certainly help with a lot of the symptoms because people do find, as we discussed earlier, they had quite a bit of anxiety and agitation and insomnia, and all of those things can be helped with the cannabis for sure. So in many states where people are lucky enough to have access to it, certainly something that they should try.
Sure, smoke cannabis, which has more mites in it.
Oh.
Sure, it makes sense. Don't deal with the
Typically
mite
get
problem.
worse in,
Just,
humid weather.
keep lying to ourselves.
The symptoms always get worse in terms of what I've had reported to me, my patients. But then again, when I just go in and study skin diseases of various types, the same can be said for pretty much anything that's a skin problem. So why that is, I don't know or can exactly explain, but people do have worse symptoms in certain weather. And I have patients, I remember one patient I'd had for 20 years, he had had this for 20 years, and he said that waxed and waned, he would be fine all winter, and then every summer he had terrible symptoms. And this had gone on for 20 years for him. And so definitely the hot weather, when people are sweating, when there's humidity, those make people a lot more uncomfortable. But I don't know if that's any different than any other.
There is a temperature thing that we could talk about, and I'll have to remind myself to talk about that later. Going from hot to cold, what the pores are opening up in the summer and you're sweating them out. There was other people talking about this the other day.
Well,
And
I do know
they'll sweat them
people
out, but you can see a big
feel,
difference when
a
you go
lot better
right out into the cold weather,
when they
and
don't
you'll notice a big
eat
difference. You can
sweets.
feel them. You're gonna have to
They
feel
take
your
the sweets
body,
away from their diet.
and don't just go
really,
to the
really
doctor and
seems
ask the doctor what you
quite a
feel.
bit.
You have to
And then
recognize
when
it
they do
yourself.
reintroduce them, it aggravates symptoms a lot. A lot of the patients it's helpful to get off of gluten. But again,
Yep.
see, I think these are all because
Glutens and yeast and all the fake fucking yeast shit that we do and all the processed foods, all fake shit that the Morgellon might, they love that shit, man. They love the processed sugar and stuff too.
And which could include Morgellons disease.
Sugar proteins.
As well as all the tick-borne diseases and any number of diseases that have inflammation in the body. So anything we can do, the anti-inflammatory diet is something that I always highly recommend to people, which usually involves getting rid of refined products, getting rid of sugar, of course.
Yep.
Any kind of the processed oils, any
Yep.
preservatives.
Yep.
All of those things incite inflammation in the body.
And how do you take fluoride out of it? How do you get rid of fluoride? Impossible. You have to distill your own water. You're going to have to start taking showers in distilled water. Otherwise, the fluoride absorbs in through your skin anyway. Everybody's got to get together on all this shit, man.
I don't think so, no. I really, I don't think we're going to be able to come out with a good Lyme vaccine.
No, you're not going to be allowed to.
I feel like this has been a very controversial topic. When you think about this, Jeremy, you could get Lyme disease over and over and over again. You cannot have immunity to the disease, even based on the fact that you personally have already had it. So how are you going to have an effective vaccine when the whole purpose of a vaccine is sort of
by properly diagnosing it and stop calling it Lyme disease? It's not.
But if you can't even have the immunity from having had the illness before, how is a vaccine ever going to work? And people can get Lyme disease over and over and over.
That's right.
So I just I just would feel very skeptical about the ability for us to come up with a vaccine.
Let's admit that they're
People always say
nanomites.
to me, well, if they have it for dogs? Well, dogs have very different immune systems than we do. And it's true, they do have a vaccine for dogs, and apparently it works very well, but we're not dogs, so we can't use that same vaccine.
Yeah.
Now, the
See what I mean
bacteria
about the medical
typically lives
industry,
in
man?
animals
They're
and is
fucked
carried
up,
to
man.
humans by ticks. But in animals, it doesn't typically have the destructive effects that it does in humans. Is this correct?
Right, that's true. They don't actually, they're not actually sick with the Lyme disease, no.
Mm-hmm.
And so, but we are infected by the tick bite. But people often say to me, well, especially when I lived in Texas, I had a lot of hunters that would kill deer, and they were always concerned about eating deer meat. They said, well, if they had all these ticks all over them and the ticks carried Lyme disease,
That's right.
would I have to worry about getting Lyme from eating the deer meat? But no, actually, you don't. First of all, going through the GI tract like that, it wouldn't survive. So that's one thing. And one of the reasons that we get the infection so easily from the tick bite
But the
is
nanomites
the
will.
tick actually injects an immune suppressing substance to make the body just more able to contract the disease. And so, I think that's where most people are getting it. Now, we talk a lot about vertical transmission, mother to child transmission, sexual transmission. There's still a lot of controversy about all of those, but as far as what I've seen just in treating patients through the years, I've seen a lot of, I've seen situations where I know for sure there was vertical transmission. In other words, the mother gave it to the baby in utero. And so that's another way that people can contract the disease. There's still a lot of controversy about whether people can contract it through other bites. People have been convinced they've gotten it through horse flies, and
Chicken eggs.
I have
Chicken
patients where
eggs.
those were the only bites they had were something like horse flies, and yet they come.
Chicken has the nanomites.
So
chicken eggs will do it.
The conservative view has always been there's only one way to get this, a tick bite. That's it. But I think there's just so many other ways that we probably are going to find out that people can get it through other ways.
Don't mosquitoes feed the same way that ticks do?
Yeah, well, I think mosquitoes, there are reasons why mosquitoes probably are not carriers of this. But I'm not, I don't feel qualified to really talk about that. I do know that there's some rationale behind that, but I personally am not qualified to talk about that.
Well, they certainly carry the malaria.
Yeah, that's true.
Dr. Sade, we were winding down to our last few questions here. This next one's a big one, too. What is the difference between psychodermopathy and dermatoborreliosis?
Well, the first one, psychodermopathy, is basically, it's a psychiatric condition. In other words, somebody is having itching, somebody is gouging at their skin or whatever, but they're doing it simply for psychiatric reasons. And so that's a psychiatric diagnosis, really. The second one is a term whereby borreliosis, in other words, the bacteria that causes Lyme disease, is found in the skin. Now, we have found borreliosis in the skin of Morgellons patients. So does that mean that Lyme disease, or let's call it Lyme disease instead of borreliosis, is causing Morgellons disease? Could be, but we can't say that for certain, because just because there's the presence of the bacteria in the sick person doesn't mean that that is what's causing it. I always kind of use the example of back in the old days, they used to say chronic fatigue syndrome was caused by Epstein-Barr virus. Epstein-Barr virus is very prevalent, it's in the population. A lot of people have Epstein-Barr virus, probably the majority of people do, and the virus increases in titers whenever the immune system is suppressed. And so they were finding high titers on all of these people, so they immediately assumed that the Epstein-Barr virus was causing chronic fatigue syndrome. Well, it turned out not to be the case. It was just these titers were opportunistic. In other words, the virus was taking advantage of the suppressed immune system. So what we don't know is whether the Lyme bacteria is opportunistic here or whether it is the causative pathogen. But there is the association, which is certainly enough to make us want to go forward and study and learn a lot more about what the connection is.
So it's incorrect to suggest that Morgellons is psychodermopathy.
Absolutely. That's my strong feeling. Now, of course, many doctors would disagree with me on that. Most psychiatrists, most dermatologists are still thinking of it as of a psychodermopathy. In other words, a strictly psychiatric condition.
Right.
I do not believe this. I think anyone who's taken care of as many of these patients as I have can see that there's clearly something physiologic going on here. This is not a psychiatric condition. There may be some psychiatric symptoms, but those are as a result of the infection itself. Those are not the condition. The condition is not a psychiatric condition. And that's what we need, is to make that clearer to the population at large, and particularly the medical community, so that they'll take this disease more seriously and really study it. And study it more seriously than they did with that CDC study, which there were just too many problems with that study, and I think it was a rather ingenuous attempt at solving this mystery.
So is there any easy way to ask your doctor to get this skin test to see if the Borrelia is inside the skin?
Yeah, I don't know. Of course, you first have to get them to pay enough attention to take you seriously,
They're
right?
already working with you.
Yeah. Oh, if they're already working with you. Well,
He does have
problem
Morgellons.
is
All right.
that,
So yeah, somebody should get him
I think
some.
that-
This is what I'm showing him. This
you know,
Jeremy
usually
Murphy. That's how you say his
you're
name.
not going to find to be the average lab. Let's just say, just any average lab that your doctor uses. I won't name any names, but just the labs that people usually use for most of their stuff. I don't know that they're really going to pick it up. We've been picking it up in research laboratories, and a lot of times research laboratories are able to find things that the standard diagnostic laboratories are not.
Not even, because they don't go down to a nano level.
I don't
So
know
not
for
even
sure
them.
that
They can't even help you
that
with
would
this.
be the answer, having them send it off and look for Borrelia bacteria.
No.
But it would be a start.
No, it isn't.
If you have
Get
a
away
doctor
from the
that
medical
pay enough
industry.
attention to
Fuck
you
the
to do
medical
that, of
industry.
course. I think that what first thing that we need to do is have people tested in specialty labs, probably for the Borrelia bacteria.
Oh yeah, sure.
And rather than just using coming for standard laboratories, because the specialty labs will use a different antigen soup. In other words, they will look for antibodies to antigens that are present in many different types of Borrelia.
Yeah, and you won't find it because it's on a nano level.
We sort of have our blinders on if we're only looking for one Borrelia here. We've got to look at a bigger picture.
Sure
and
do.
That's what's not usually being done in the regular laboratories. If anyone has a doctor who has been sympathetic to them and would like to help them, if those doctors would email me, then I would be more than happy to send them some direction in terms of how to test and what kind of treatments to try. I cannot send that information directly to patients because I've already been in enough trouble in my days of practicing. We have to be very careful about providing treatment information to people who are not our own patients. But I can provide that to your doctor, or when I say doctor, I mean loosely a nurse practitioner, PA, whoever's taking care of you.
Right.
And they
so don't
can
bother.
email me
So don't bother.
to Lyme.
It's fucking useless.
That's LYME, like Lyme disease, and then DC, which stands for District of Columbia, where my office is, lymedc@gmail.com. And then if they will.
Yeah, so it's all useless. It's all fucking useless because what they do is you're just gonna keep getting the runaround. You're not allowed to heal yourself anymore, so you just have to keep your mouth shut, lie to these fucking assholes because everybody's just, if the doctors are not able to help you, they're not able to. Their hands are tied. We have to face facts. So don't bother. They're sending everyone down the wrong roads. It's not misdiagnosis, it's mislabeling the diagnosis in the first place. So a lot of these health issues are related to these mites and nanomites, electromites, nanomites. A lot of the sicknesses and ailments that we're going through right now throughout society, a lot of them. I'm only talking about the Morgellons and the skin mites because that's one of the things that's being misled. But once we get through these two, a lot of the other ones, a lot of them are all part of this. What I'm calling the M&Ms. They're all part of the M&M categories. In other words, if the tick is infested, let's say the tick is infested by a certain M&M population, then that tick is carrying what we now call Lyme disease. I mean, they're not, so they go for the Lyme disease, but yet they don't talk about the M&Ms. They can't talk about the M&Ms. They're not even allowed to. There's even a certain portion of these M&Ms that go into our food supply, and it's admitted to. They admit to it. They don't tell you what the nanocarbons are, but they admit to a certain amount of nanos going into foods that we that we eat on a regular basis. So it's all right in plain sight for us to see. My recommendation is that we all start working together on these things and say, fuck the medical industry. They are not helping at all. They're making everything worse. And if you go along with their diagnoses and their shit, they're just going to run you into, you're in an early grave. Because anybody living with this shit is not really living. Life is fucking already over. So at 20, 30, 40, 50 years old, life is done now for you. Fuck that, man. Fuck these fucking people. We got to take the system back, man. We got to take the system back. And this is where we start. We start by identifying and seeing the system for what it is, the entire system. But if you're only on the Morgellons and that's all you're interested in, then I think I can help you. Whoever knows this guy, Jeremy Murphy, if anybody knows him, send him to these few videos I got on the Morgellons and the mites and throw it by him. I think he would take right off with all this information. But he does seem to be very interested in what the medical industry is telling him. So maybe not, I don't know, but it's worth a shot because these are the type of people that we want to reach, is people like this Jeremy Murphy guy. He's got 13,000 views. People like him. Just on this one video, he's got almost 14,000 views. So if he goes and researches what I'm telling you guys and what I'm explaining to you all, then he will take off with this. He doesn't have to refer people to my trash mouth swearing, weird way of looking at things. He has his own way. But if he gets the information and he starts to look at it, he will see things in a new way. Maybe we'll get lucky on some of this. All right, let's see if I can finish this up. Hold on.
And the good news is that I've been excited about is I have been getting more and more doctors writing to me for this information, which tells me that at least more doctors are getting open-minded enough to know.
Yeah, right. See, I don't like all this nice talk about fucking doctors in the medical industry. No, they're not going to help you, anybody. They're not going to fucking help.
But surely, things are changing.
Help you get you into the fucking ICU units in the mental institutions. That's what they'll help you to do.
Dr. Stagley?
We just wish it would go faster, right?
Right. What do you like to do to kind of loosen and relax when you're off work?
Well, I have.
All right, now it's just getting personal shit. So, all right, we'll end it here. All right, I'll be back.